autoimmune disease is basically a dysregulation of the immune system. It's basically a process that kind of goes haywire in the body. Normally the body is able to recognize its own self compared to some other foreign substance or foreign particle that comes into the body, such as bacteria or viruses or funguses or fungi. And when the body loses the ability to recognize foreign from self, that's what triggers autoimmunity. So your own protective mechanism starts to attack parts of your body that actually truly belong to yourself, but it thinks that it doesn't. We truly don't know. There's different theories out there, but generally it's a belief that it's a combination of a genetic predisposition and something in the environment that triggers it. In terms of the environmental triggers, there's been different theories that have ranged from something to do with pollutant in the air or in cigarette smoke. The most looked into theory now is essentially looking at the gut microbiome, which is a collection of bacteria we have when we're born with, and if those help form the immune system. When that balance kind of goes off, that may trigger some aspect of autoimmunity. But again, we're not entirely sure. There's a few running theories on it. So one of the most common types is rheumatoid arthritis. Another common type is systemic lupus, psoriatic arthritis or psoriasis, Sjogren's condition or Sjogren's syndrome. They manifest in different ways. One of the main components that can be associated with all of them, or most of them I should say, is inflammatory arthritis. That's when generally people have joint pain, people have joint swelling. Symptoms tend to improve more with activity as opposed to with rest. Whereas for osteoarthritis, people tend to feel better when they rest as opposed to when they're active. But you have to remember that these conditions, even though, for example, rheumatoid arthritis is named rheumatoid arthritis, they're systemic conditions, so they can involve technically any part of the body and any organ in the body, which means the eyes, the lungs, the kidney, the liver, the skin. And so truly they're all systemic conditions. They can just manifest in different ways. And the important thing to remember is just because one person has rheumatoid arthritis that presents in one specific way, it does not mean that the next person that has rheumatoid arthritis presents that same exact way. And so it's very important to touch base with your rheumatologist and try to determine if the symptoms that you're having are part of your condition or they could be not associated with your condition. And in terms of treatments, the more conventional treatments that we usually start people on are a class of medications that are called DMARDs, which stands for disease-modifying anti-rheumatic drugs. And those have been around since before the 90s, before the year 2000. Medications such as methotrexate, hydroxychloroquine, sulfasalazine, leflunomide, steroids play a big role. Since probably around the end of the 90s and early 2000s, a new wave of medications such as biologics, they started to take wave and be one of the mainstream lines of therapy, which has been a huge advancement in rheumatic conditions altogether.